NACCHO is the voice of local health departments helping to make sure that policymakers understand the role local health departments play in keeping communities safe. In this video, we'll go through a couple of scenarios that will provide some guidance on how to communicate with policymakers about public health issues, whether that's with your local decision makers or with your national representatives here in Washington, D.C. As a local public health official, it can be a challenge to stay on top of what's going on in Washington, D.C. You should know that as a local health official, your voice is important. Members of Congress need to hear from you to let them know what's going on in their communities. In order to be an effective advocate, it's critical to understand the difference between advocacy and lobbying. In this scene, we will take a look at the difference between an advocacy message versus a lobbying message and clarify what makes each unique. Let's take a look.
Thanks for coming in today. What can I do for you?
Of course. So what I really wanted to dive into and talk about today was the emergency supplemental bill that's currently being considered by your colleagues, and it's on the floor today. Right? So it looks like your boss is sort of on the fence, right? And what we really wanted to drive home today was why supporting that bill would be critical, right, to our public health agencies, right, in our community who are on the ground working to help our community recover in the aftermath of the recent disaster. Can we count on your support for that bill?
Well, I'll relay your message and I'll get back to you on it.
Great.
Is this message an example of lobbying or advocacy? That's right, this message is an example of lobbying.
What I really wanted to touch on today was the role that local health departments play in helping their communities prepare for natural disasters and emergencies and helping them respond and recover in the aftermath. So I brought a fact sheet in here for you today, and we can quickly go through what local health departments are doing. Right, so local health departments are on the ground supporting communities affected by emergencies by setting up and staffing shelters. They're also providing supplies like potable water and vaccines, and then they're also working with groups like the Medical Reserve Corps to train volunteers and coordinate them as well, working side by side with the community to help communities bounce back even stronger. And these activities are funded through the Centers for Disease Control and Prevention, which help my local health department prepare, respond, and recover to natural disasters and emergencies.
Thank you for that information.
Is this an example of advocacy or lobbying? If you said advocacy, you are correct. The main difference between lobbying and advocacy is that lobbying refers to a specific ask in support of or opposition to a specific piece of legislation, in this case, the emergency supplemental bill. Advocacy, on the other hand, involves educating policymakers and the public with nonpartisan information, research, and analysis about the importance of a program or issue area. Let's take a look at another scenario. In this scenario, we will identify some key components of messages that are clear, concise, and effective when communicating with decision makers. See if you can tell the difference between an effective message and a weak message.
Thanks for coming in today. What can I do for you?
Thanks for having me. So what I wanted to talk to you today about is a very important part of what we do at our health department is immunization services. And you may or may not know that immunizations funded in our community, the money comes partly through the Prevention and Public Health Fund, which was created in the Affordable Care Act. And we have a big problem with people in our community either not thinking that they can afford immunizations or being anti-vaccination. And we also have an obesity problem. People are not exercising the way they need to, and the school meals, I don't know if you've seen the school meals, but they get pizza twice a week, and it's just, you know, these kids are overweight and they don't get, even in middle school, they don't get recess, and we just have big problems with health in our community.
Is this scenario an example of a strong message or a weak message? If you said weak message, you are correct. In this scenario, the first thing we notice is that the message isn't clear. It is also very important to be confident and present yourself as a qualified expert on a given subject whom decision makers can trust as an evidence-based resource. Finally, it's important to frame your message to answer the question, so what? In this next scenario, we will highlight the important aspects that make a message clear, compelling, and answer the questions of so what.
Thanks for having me. So I wanted to talk to you about an important issue in our community, and that's immunizations and making sure that people are protected against diseases. The funding that my health department gets for these services comes through the 317 immunization program at the Centers for Disease Control and Prevention. And that allows us to really serve the community and make sure that people get the immunizations they need to stay protected from things like measles or even the flu, which kills 30,000 people every year. And that money comes through the Prevention and Public Health Fund. Actually, half of the funding annually across the nation for immunizations comes through the Prevention and Public Health Fund. And if that were to be eliminated, it would really put our community in jeopardy. So I really hope that your boss will continue to support funding for immunizations and for the Prevention and Public Health Fund.
In this example, this message was clear and concise. The advocate went straight to the point that the immunization program is vital to their health department. The conversation never veered into a different subject and maintained the message of the importance of funding for the 317 immunization program. Let's take a look at one more scenario. In this scenario, we'll touch on some important things to keep in mind when communicating scientific data, research and analysis when messaging for policymakers, media, or public audiences.
Thanks for coming in today. What can I do for you?
Sure, what I really wanted to talk about was some research that have come out in recent months, and I'm not sure if they're positive, right? So what I want to talk about was the AQI measurements in that research. So the confidence intervals are strangely narrow, and we've been seeing a 12% increase in our PPBBs over the last maybe 2 or 3 years, and that's alarming, right? So a couple of our measurements that we've done privately for some of our environmental health assessments indicate that we might be over what's allowed in the NACCHO pretty soon. Now that's a problem. That's a problem, and we need to do something about it.
When communicating data, you want to be as clear as possible without complex jargon and confusing acronyms. When possible, use simple language, spell out acronyms, and explain complex scientific concepts in ways that are easy to understand. Also use stories to effectively get your message across. Provide real-life examples from your community alongside data to help provide appropriate context and illustrate the meaning and real-world implications of a statistic or trend. Let's take a look at one more scenario.
Thanks for having me. What I really wanted to talk about was air quality, particularly in our community, and what we need to do about it to improve. So air quality is important for public health because when air quality is poor, children have to stay inside, they don't have as much space for physical activity, and that has cascading effects on public health at large. It's important that we understand what are the root causes of this air pollution spike we've been seeing in recent years, and then get to the bottom of it, and then figure out solutions for how we address it. Which is why we support funding for the Center for Environmental Health at the Centers for Disease Control and Prevention, which provides resources and capacity support to local health departments like mine, which are trying to protect our communities from environmental threats.
Thank you for that information.
Thank you.
Notice that this message was clear and concise without the use of jargon or acronyms so that congressional staffers can clearly understand the issue. We hope that the scenarios we've gone over help illustrate how to communicate effectively when meeting with your members of Congress. If there are 2 things to remember from this series, remember this: you are a qualified, trusted professional, and members of Congress rely on you for your expertise and knowledge. For more information on how to schedule a meeting with your member of Congress or their staff, the legislative calendar, NACCHO fact sheets, talking points, and more tips, visit NACCHO's website, naccho.org, to find the NACCHO Advocacy Toolkit at the link below. If you have any further questions, you can contact any member of NACCHO's Government Affairs team.